Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, Anita Finley.
You can't just go anywhere. Everyone says, come to me, we'll make you pain-free. You have to be very careful. And we are so pleased that Leslie Carmen is someone who has really figured out how to take this to the next height. So hi, and good morning, Leslie.
Good morning, Anita. How are you?
We're great, thank you. We've just been through a whole detoxification, and now we want to talk about getting pain-free. So why do people have pain? Who have you been seeing that has pain?
Oh, we've been seeing a lot of elderly people, obviously, that have, pain in their knees and their backs and generally just arthritis all over their body and inflammation. And, the detoxing is just fantastic because it gets rid of all those toxins, frees your body to really start healing again. And when we can give laser, we're stimulating those cells to regenerate and rejuvenate and help as well as reduce the inflammation that's there. And then your body starts to heal, and new cells are created in all different kinds of tissues, so muscle cells, bone cells, cartilage, nerve cells, and your body regenerates and you start healing.
Leslie and I have seen you do this with people, and I've, of course, heard the lectures, but why don't you start off in a sense and tell people about the laser itself, what it looks like, and why there's absolutely no pain as you're doing this?
Sure, I'd love to do that. Well, there's a lot of information about lasers, and it can be very confusing because with a lot of things, this is an old technology used since the 1960s, yet it's developed. But there are various types of lasers, and then there are various wavelengths and various ways to deliver this wonderful healing laser. So we use various kinds. We have a class 4 laser, which needs to be behind closed doors, and you have to wear glasses, protective eyewear. You're only allowed to be in the room itself with the patient, and that is more of a high-powered laser, and it has a byproduct of heat. So you receive the laser and also some heat, and that's a class 4 laser, but will not hurt you or burn you at any time. But yes, it is a laser that needs to keep moving. Then there are other lasers that are called the robotic lasers, where you lie down on the bed and the robot laser will literally just fix on one point and stay there for a few minutes, and that will also not burn or cut. And these lasers penetrate 3 to 4 inches deep into the tissue. Then there are other classifications. So there's a 3B laser, and with that 3B laser, that was the one that was used to get the FDA clearance to treat carpal tunnel syndrome back in 2002. So that is another specific laser. Then there's a very low-level laser, which is a class 1 and 2. And these lasers, you don't feel any pain or any heat whatsoever. And those lasers are very, very gentle but unbelievably effective. And that was one laser that I used yesterday, if I may talk about this. We went to the Sebring Racing in Sebring, and we have a patient of ours. His name is John Gorsline, and he insures race car drivers. So we said, well, let's do a test together. And let's see, you have these race car drivers that have excruciating pain because they've had, some of them have had terrible, terrible accidents. And when you drive like this, you get neck pain and headaches and back pain and knee pain and so forth. And we said, let's try and see how this laser could work on the racing team. So we were really excited, Trent and myself. We went to Sebring yesterday, and the day before. And we had such fantastic results with this that we're going back there this morning. That's right after this call. I'm gonna drive back up to Sebring and start treating some other people there. And that was a laser that was so easy for us to transport because it's lightweight. It's not one of those class 4s. It's a class 1 that you can treat in an open room. Don't need glasses. Don't need protective wear. And so we treated that in his suite. It was quite interesting looking down on the practice, on the racing cars, flipping back and forth, and we're there in the suite treating all sorts of different painful conditions. So
how fast can you feel results?
That's a great question because we treated 12 people, and out of the 12 people, 11 people felt phenomenal. So I thought I'd just give you a couple of things. So one race car driver had hurt his rib, and we treated his rib, and he had pain for years also. So we just treated his rib for 10 minutes, and he felt immediate pain relief. For him, it was pain relief. It wasn't no more pain, but he said it was fantastic. He was just able to, move better, felt instant relief. My most exciting case was I had a very famous race car driver who had a terrible car accident in 1983, and his leg had been burnt and his ankle was completely, disformed. And he told me that for, over 33 years he's been walking with pain constantly. He says when he sits he's okay, but the minute he stands up and walks he has been in constant pain. So I love those kind of challenges. So I started treating him with the laser right in there in the suite. Just had to take off his shoe, his sock, and treated his entire knee, leg, ankle. And so when he put on his shoe, I was very, anticipating, okay, so what's going to happen? And he stood up, and you should see the expression on his face. He was like, oh, my God, I cannot believe this. And he started walking back and forth. He said, no pain. And there was a whole buzz going around in the race field there saying, my God, did you see, this and this guy had treatment, and he's in no pain for the first time. And, I mean, those are sometimes things that you just can't even fathom, that somebody's had pain for so many years. Now, obviously, we're going back there today, and I'm looking forward to seeing how he's doing today. You do need a series of treatments. So we were just unbelievably lucky to treat so many people that had an immediate response. So we treated shoulder pain. We actually had 3 people with allergies and sinus problems, and we know that the laser helps phenomenally with that because it instantly reduces, the inflammation in the sinuses. And the sinus area is a very hard place to get blood flow going. So when we give the laser there in the sinus cavities around the nose, above the brows, then you're bringing instant blood flow to that area, which instantly reduces that inflammation. And it was so funny. Every one of them, after we had treated, had to go blow their nose and was able to relieve a lot of that mucus. Yeah, it's just fantastic. I mean, this is such a great field to be in.
Yeah, I know. And you're so enthusiastic. And, of course, we all know, or at least people who have listened to you before know the story, that you're definitely, it was a personal thing with you, with your daughter who was suffering terribly, and that's how you discovered this. It's, things always seem to happen the way they're supposed to. But what I wanted to, Leslie Carmen is the clinical director at Carmen Care Advanced Laser Therapy, and I want to give a phone number. So, you can call, and they have offices all over South Florida. And so just call, find out when, she'll be at an office closest to you. Phone number is 561-405-9577. Again, that's 405-9577. And then you can go to their website. If you do that, you'll really see a lot of pictures, a lot of information. And that's called CarmenCareLaser.com. CarmenCareLaser.com. Now they have, very interesting people who work there. I was very fortunate, of course, to meet Leslie Carmen, who really is the founder, and she's started that. But they have other people who are in the they understand all the questions I'm asking her, that they give lectures, and they do have lectures all over South Florida. So if you call, they'll figure out, when they're having one and when it's going to be convenient for you. I wanted to go into something that you talked about, the carpal tunnel syndrome. I knew somebody who was going to have an operation. And those are painful and they don't always work. Correct. And you have been very, very successful with relieving that for people without any surgery, haven't you?
Yes, that is correct. The thing with carpal tunnel, and I'm not a doctor here, so I just always want to make that clear, but we have so much success in our clinic. Patients come to us and they say, I've been diagnosed with carpal tunnel. And they say, I've had surgery and it hasn't helped me. Well, what happens with carpal tunnel very often is that it isn't always carpal tunnel. You can have symptoms that seem like it's carpal tunnel, but it could be a pinched nerve coming from the neck. It could be just general pain in your wrist for overuse. It doesn't always have to be carpal tunnel. It can be arthritis in your fingers. And we've had all sorts of different people come to us that say they were diagnosed with carpal tunnel, but they had other symptoms. And so what we do with that situation is we always treat the entire root cause. So we look at everything that could be possible that's causing that pain. So we don't just treat the carpal tunnel area, which is the wrist and that band that can get tight and compress on the nerve. We go from the neck, and we start treating the entire neck. We follow the nerve all the way down the arm into the wrist, and we treat all the fingers. So this way, we are relieving any possibility of that pain. So we're treating the nerve, we're treating the arthritis in the fingers, we're treating the arthritis in the neck, and we relieve the symptoms. So basically over 90% success rate with carpal tunnel. What's interesting with carpal tunnel, when you do have that surgery, you're really cutting into the band, right? And what is our body made to? Our body's made to heal that again. So really it's just going to close up again and heal and tighten up again. But if you're treating the root cause, bringing elasticity back into those cells and healing a nerve that might have been damaged or pinched, or you're relieving the arthritis that's causing inflammation, then you're really relieving the source. You're getting to the source of the problem.
That's excellent. I'm so glad the way that you're so articulate about it. It's a difficult subject because people don't really understand this, and it's like laser. They're going to put me through. They think it's like an MRI. But of course it's not. I've seen you do that. They sit comfortably in a chair and you have this little machine. And by the way, I don't want to forget that. People have asked me, well, what if I can't go there? I live up north. Once you show them how to use the machine, can they do this themselves?
Absolutely. There are different types of lasers, and we have one that we particularly really endorse, and that's called the Delta laser, and it's coma therapy. It is so gentle that, a child can use it, even animals. So actually when we were at the Sebring race, one of the dogs that was there fell off the couch, hurt himself, and we quickly treated him with the laser, and he was running around within 5 minutes again. So
you did this on a dog?
Yes, it's crazy, isn't it? That's actually where laser was started in the veterinarian field. But, back to your question, yes, you can purchase a laser that is a home use laser. Now it's a little bit less powerful, but yet very, very effective, and it doesn't mean that it's not going to help. It's just you treat yourself a little bit more frequently, which is fine because you're at home, you can watch television, and while you're watching TV, you can put this laser device on your knee or your ankle, your neck, your head if you have headaches, and you just treat yourself every day for about 3 weeks, and then you give yourself a rest, and then you treat again every day for 3 weeks, and it just depends on what your problem is and your condition. And we always support you. So if you purchase the laser, we will spend an hour with you on the phone or Skype if you have that available, and we will direct you as to how to use the laser, where to apply it, how many times to use it. And all my patients have my direct cell phone, so they can text me, and I get texts all day long, saying, okay, what should I do here? How can I do this? And I just usually answer within 24 hours, and we give great support, so you're never alone with this. And the results have been outstanding because what happens is you become one with this laser. You really appreciate what it can do for you and how it can help you. And when you keep it out on the table, you're going to see that. You see it and you're realizing, oh, wait, I just burnt myself. Let me quickly treat that. Or I have a headache. Or my grandchild's here and he's got a tummy ache. So you can just use this all around. We nearly call it like your little emergency kit. It's got to be in every household.
Yep. Well, it is true, and I can see people having that very small. Now, it's battery operated, right? So you just charge it?
Correct. Yep, there's a battery, and that battery lasts for about 12 to 24 hours. You charge it in the wall at night. You use it. You can usually use the battery for about a week. Obviously, we charge ours every day at night and at the office, but for the home use, and you can take this with you. It's very, very light. It looks maybe like something like a microphone or a flashlight, something like that, but much lighter in weight. They constructed this so intelligently, so the handpiece does not have the battery in it, so it's very light. And the battery is separate, as it mentioned, that's charged, and it's on a cord, and you just can carry it with you anywhere you go. In bed sometimes, if you're lying in bed and you've got pain, and you can just use it practically anywhere. It even comes with a car charger, so you can, if you're driving together and your husband's driving and you want to treat something, your knee or your back, you can do that while you're driving.
Oh, this is really the new world, the 21st century. And you, of course, and your daughter, does she have any more pain? Do you have to constantly treat her, even though?
We don't have to. No, absolutely not. So when she had her pain in 2010, it was really excruciating. She had to be on medication, pain medication, and other forms, and it was just horrible. She was out of school, she couldn't work, and she had to have, daily treatments at that time until she got better. Once she got better, she was completely, we always say about 95% pain-free. And she has been that way for 5 years. Very seldomly, if there's a stressful situation, we all have stress in lives, right? So if there's a very stressful situation, she might get a little bit of tingling, and then she'll just treat herself once, and that's it. She never has to do that whole treatment again. And so it's been fantastic. She's on no more pain medication. Doesn't take any medication whatsoever. She works full time. She plays hockey 4 times a week. She actually just won the nationals and the state championship. That's what it was.
Oh my goodness!
Yeah, and when you think about her condition, trigeminal neuralgia, one of the triggers is the temperature change from cold to hot. So if you think she's in Florida, one of the warmest states, and then going into an ice hockey rink, which is the coldest place you could ever be, and, being able to do that temperature change on a daily basis is really quite fantastic.
Oh, I don't think I had heard that story before. So as an athlete, this could have destroyed her.
Oh, it did. It absolutely did. She had received a scholarship to Northwood Lake Placid School because she was such a great ice hockey player. And when she was affected with this, she had to stop school, and they were fantastic. I mean, they homeschooled her. We did the school through the internet. I was there with her. The teachers were always waving and, helping her with her schoolwork. It was really fantastic. But, yeah, she had to stop going to school, and she was just at home. And I remember, trying to cheer her up a bit and say, let's go to the mall. And we would, go to a mall, 17-year-old girl. After 20 minutes, she's like, listen, I got to go home. I can't take this. I can't walk. I don't feel right. And, so your life is really over at that time.
Oh, my. Can we go back to the dog?
Yeah, absolutely. I love dogs.
Is that something new that we can promote? I mean, what do you think?
You're absolutely welcome to promote that. Yes, we have a Facebook page, and it's called Carmen Pet Care. So we're adding that.
Oh, no kidding.
Yes.
Carmen Pet Care. Now, will the dog just sit there while, it's like being petted?
It is, and it's so beautiful because dogs have this natural instinct of feeling energy. You see, they're still very, very in tune with their body and their surroundings. And you can have a very hyper dog, but as soon as we hold him, put this laser on his hurt area where he's got pain, the dog suddenly becomes very calm. And he's feeling, number one, that something's happening to him, somebody's taking care of him and loving him. But I think the energy itself is just very, very soothing and calming. And while I'm saying this, I actually remember when I was at the Sebring, a lot of the patients that we were treating there, the race car drivers, and people were saying, wow, this really relieves you and soothes you, and you become very, very calm, and you can fall asleep. So the energy is felt throughout your entire body.
And if someone comes to your office, how long should they plan? How long does this take?
Well, the consultation is an hour, and it's always free. I love to figure out, where is your pain coming from, what are your symptoms, and people can bring MRIs and X-rays and give us their report. And that hour, then we determine what you have and how long we think it's going to take to heal. Now, normally treatments go from about 12 to 20 treatments. You do need that much time because, remember, we're doing natural healing. So I always love giving the example, if you break your arm, you're going to be in a cast for 6 weeks because that's how long it takes for your cells to regenerate and the bone cells to fuse again, So we follow that natural healing, so that's how long it's usually going to take with most cases, with most pain. So, I put that together, and depending if you've had surgery, you might need, those 20 treatments. If you have spinal stenosis, that's quite severe, you're going to need those 20 treatments. If you have just knee pain, that's not really bone on bone, but it's just inflamed, then that's probably maybe you're just going to take 8 treatments. So I determine at that point in time how many treatments you're going to need. You usually need to come into the office 3 times the first 3 weeks. Then we go down to 2 times and then 1 time. So we spread it out over a course, but that isn't something that has to be. That's not set in stone. I can work with anybody. I have people that come away from Miami, and they can only make it 2 times a week. So then I'll just do a custom protocol for them. So everything's customizable and everything's doable, and we work with everybody, and we really, our goal is to get everybody better.
Oh, you're such a champion. You're a heroine.
Thank you.
So if someone's sitting there, is this 20-minute treatment?
Yes, 20-minute treatments. Some are maybe just 10, but usually it's about 20 minutes treatments. And we are very, what is the word I'm trying to look for? Respectful of your time. So when your appointment is at 10 o'clock, you get treated at 10, and 10:30 you're out. So we don't want you to sitting there waiting, because I know it's a lot of treatments. We're asking a lot of you to be there 20 times, so we understand that, and we value and respect your time. So we'll get you treated right away, and then you're out to do the rest of the things you wanted to do that day. It doesn't cause any pain, no harm, no side effect. Sometimes you can get a little tired from it, but, nothing where you couldn't be driving or so. But a lot of our patients welcome that rest, and they welcome to finally have a good night's sleep, and they welcome to be a little bit calmer and feel this soothing, healing happening to the body.
And so can you do this every day? What do you recommend? So you're treating somebody, and you said that it's going to take 10, 15, 20 treatments. Is that once a week, twice a week, every day? What?
It depends on the condition you have. Usually it's that 3 times a week for a few weeks, and then 2 times, and you temper that down. But I have a couple of protocols that I actually treat somebody 3 times within 24 hours. I call it 324. So if somebody's come and they've literally sprained something, or they have a spasm in the back or something acute, we'll treat 3 times within 24 hours, and usually within 48 hours the patient is pain-free. And I also have something called the flu symptoms. So when you have the flu and you have these terrible symptoms of headache and congestion and sore throat, we'll do 3 treatments within 24 hours, and usually the next day you feel pretty good.
So we're talking to Leslie Carmen, and this is called Advanced Laser Therapy. It's called Carmen Care. Stop the pain, start the healing. And they have offices in Boca Raton, Aventura, Plantation. I know you're expanding also, and if not, if you can't get to these places, once you can get there once or twice, then you can purchase this laser. Well, I guess it's a laser, and you're instructed. I mean, you give a whole course on this to them, don't you, before you sell it to them?
Exactly, yes. And I can talk to them long before you purchase it, so I'll be happy to give any kind of information. We send out studies, we can send out the brochure, we can talk, a long time, and just really any kind of questions you have, I'll be happy to address them. And then, once you purchase the laser, you can try. You have a return for 30 days, so if you've tried and you don't like it, you can return it after 30 days, so that's quite nice. And we're working on a plan as well, on a finance plan. So there's many people that say, it's hard for me to come up with this money, but I really need this laser. So we're working out that we can maybe make monthly payments of, $60 or something like that.
That's so nice of you, Carmen. I mean, Leslie, excuse me. You really, you have such a great heart to do this. I mean, I guess you should have been a doctor, but you don't need to be, because you have something that is doing the same thing in a sense in a particular area. So, and I've asked, what can it help? And in their advertising, it says nerve and joint pain, any arthritis, accelerated recovery, over 200 other painful conditions. We all probably only have a minute or so left, but what would be the most common condition that you're treating?
The most common is lower back pain and knees. Those are the most.
Amazing, isn't it? But one thing that I did hear from someone was so important, headaches.
Yes. Oh, yes, absolutely. The headaches. I sometimes come in the office and I feel a migraine coming on, and I'll put the laser on the back of my neck just for 2-3 minutes, and it'll already stop it immediately. Once you feel that headache come on, you use the laser and it just dissipates, because it's increasing that ATP in the cells. And it's just proven, we see it over and over and over again, how this laser can change your life and how it can just increase your joy of life. Because when you have a headache, it's debilitating. So many patients, just come to us with headaches, say, it's impossible to work. It's impossible to enjoy your life when you have these severe migraine headaches. And the laser has shown over and over that it can decrease that pain and many times eliminate it completely.
People have to have hope and faith in this, because I do know someone who's had migraine headaches for years, and And he's tried so many things. And I met him the other day. He works at a very big, fancy automobile company. And I was telling him, he says, oh, come on, I've tried everything. It's not going to work. And I'm working on him. I'm working on him to get to you.
Thank you.
Because I guess people get discouraged, don't they? So anyway, well, we've run out of time, but I have a safe trip back. I'm excited that you were able to call in and do this. So thank you. Everybody call 561-405-9577, 561-405-9577. And Leslie, that was just been wonderful talking to you this morning.
Thank you so much, Anita. Thank you for your time as well, and for everybody listening, and have a beautiful, beautiful weekend.
Yes, same to you.